everyone. There's so many people joining in from all corners of the globe, and we're honoured to welcome you. Now, I'm going to get straight into it. We're going to have a conversation. I like to think that we're all in a boardroom together. Remember those days? So I like to think that's where we are, although we're online, and we're just going to have a conversation. We're going to put a bit of structure around the conversation just so to sort of, not go off on a tangent. We're going to talk in three parts. One about changing cultural attitudes. Let's see how we can do that. Changing services, and also legal and procedural reform. We're a professional audience. All around the world you're joining in. We're all on the same team. The idea of this is just so we can share with each other and learn from each other, because we're all fighting the same battle under different legal systems and different cultures and different different political landscapes. I won't make any remarks, Nathaniel, in the USA. Look, let's get straight into it. Thank you so much. Right, so I'm going to start with changing cultural attitudes, and I'm going to start with Rosie. Rosie is particularly close to my heart as an Australian woman. Rosie, after the violent murder of your 11-year-old boy by your ex-partner, you changed my country, our country. For me, you did. The way that we used to talk about domestic violence before Rosie Batty and after Rosie Batty, there's a huge difference. You've done so much. It's extraordinary. A lot of people know your story. A lot of people have read your book. I guess I really wanted to ask you the question, how did you go about changing the Australian public attitude as extraordinarily well as you did? Could you talk us through it?
Sarah, it will soon be 7 years on the 12th of February since my son was murdered. It was an event that, it was public, it was a cricket practice, and it was something that shocked everybody. And I had no agenda. I didn't have a strategy. I didn't know what I was going to do. I didn't have a plan. I just was swept up into the most hideous, tragic event I could ever imagine for any person. And, really, people have asked me constantly about why I spoke to the media, and all I can say is I was compelled to go out and speak to the media, to actually ask them to move on, because out of respect, it was the thing to do. You ask the media to move away rather than speak to them, because there's a lot of apprehension and distrust and about speaking to the media. And so I was advised not to. But out of stubbornness, I went out to tell them myself. And what actually occurred was I started to just talk in a heartfelt way that was really saying, putting it into context, which was family violence can happen to anyone, no matter how nice your house is, no matter how intelligent you are, it can happen to anyone and everyone. And so I think I was one of the first people that was able to put family violence into that context. And previous to that, our media really didn't see it as newsworthy, topical information. So we didn't really realise that one woman a week is being murdered. 1 in 3 women, not just across Australia, but across the world at least, is experiencing physical violence. And 1 in 4 children will be impacted directly or indirectly. And those statistics I keep repeating every time I speak, because we still need to absorb the enormity of violence towards women and children. And so that shock of seeing this woman speak out at the time of her son's death was really captured everybody. And no matter what I've done since then, that was that moment that people kind of recall and remember, because it shocked everybody so much.
I think, Rosie, you were, I mean, for any of the Australian audience, they know Rosie's story. We all did. I remember, like, when I've cried with you, Rosie, before we met. I've been angry with you. I've been on the couch with my own mother and we've just sobbed. So you got to the hearts of the Australian public. Can I ask you a question about the politicians now? So you got to the hearts of the Australian public, the Australian conversation. I saw it happen around me. All of a sudden, people were talking about domestic violence. We were saying it's not on, it can happen to anyone. We need to lift our game as a nation. We have to improve. So you were so successful in that because you touched our hearts through your story. But what about the politicians? And I'm going to frame the question for those who aren't Australian. At the time that, that Rosie did the majority of her campaigning and really got things moving on a political level, she was actually operating in a very conservative government. I believe that, was it Tony Abbott who was Prime Minister at the time?
We are actually under a much more conservative government now. It has become more conservative. And I have to say that I learned a lot over my journey from a wonderful woman called Elizabeth Broderick, who is very well known. She was the previous Sexual Discrimination Commissioner, and she continues to work on many levels. It's about connecting the heart with the mind. Politicians are human. Everybody is a human being. They have children. They have relationships. They don't just go to work and put on, you know, they are human. And so very early within the first few weeks of losing Luke, I did an amazing interview with a wonderful journalist for a paper called the Saturday Paper, which was actually very new at the time. And it was really about taking, you know, really giving journalism a really great vehicle away from perhaps the Murdoch press and sensationalised journalism, but really real journalism. And he was incredibly sensitive, and I was very lucky, I guess, because you are very vulnerable when you're not experienced, you don't even realise the state and the shock that you're in on many levels. And you know, he advised me and encouraged me to make contact with the leader of the opposition in our state government at that time, which was Daniel Andrews, who's now our Premier. And I went along to meet Daniel Andrews with a wonderful person who works within the women's movement. And everybody was in tears. Daniel Andrews has a son exactly the same age as Luke. And he promised me, if we get into power, if we are successful, we will have a royal commission into family violence. And that is exactly what he followed through to do. So what I will say is, it's connecting hearts with minds. You know, when you are emotionally impacted, you cannot not do something. A lot of politicians, like any decision makers and senior people, if they can stay behind their desk in their ivory tower without coming into contact with the people their decisions impact, they can make tough calls. But when you're in front of someone and their experience is raw and it's real and it impacts, what can you do? You have to do something. And I think that that's what I've been able to do. Without, you know, by being authentic, by being able to use strengths that I didn't even realize I had, which was being honest and open and raw with my grief, but doing it in a way that wasn't ugly, victimized. You know, it was not angry. It was really gave people an opportunity to truly search within. And I will say, we are a society that victim blames women. And I still push that because we do. We do it through our legal system. And yes, we have indeed appreciated that family violence is real but it was a subject behind closed doors. Many, many generations of women that have gone before me had nowhere to go, nowhere to turn. Their family would say, you know, it takes two to tango. What did you do to provoke him? The justice system blames and doesn't make perpetrators accountable. So this is where we are still battling on many levels. But the reason I had cut through, the reason I was believed, the reason I had shock value is because I'm white, I'm privileged, I'm a middle-class woman. And I've always understood, and I've gained more and more appreciation over the 7 years I've done this, of drawing attention and not speaking for, but realizing there are many women, because of their colour, because of their culture, because of where they live, whether it's remote Australia in an Aboriginal community, whether it's a migrant woman here on temporary visas, the disadvantage and the violence that is perpetrated against them is still horrific. And it can be incredibly overwhelming, and it's really easy to think, where on earth are we ever going to see the change that we need to see? But when I do look back, as you said, Sarah, to the conversations we were having 7 years ago, we were not even having them around the boardroom table. We didn't even acknowledge or recognise the influence and role that workplaces and organisations can have. So I realise that we do move forward, and we are seeing change. But, you know, every week there is still a woman that's murdered, and every week there are still children. And it continues to confront. So we do have to look at the changes and the moves, the ways forward, because otherwise, you know, we would lose heart. And, you know, the inspiration I get are from those organisations and those made up of those passionate people who've done this for decades, way before I came along. And if I've been able to support their journey and their work, you know, at one time people didn't even know there was a refuge in the neighbourhood because they couldn't let the people know. Because if they did know, the police would tell the perpetrator where they were. It had to be kept secret.
Well,
now we see communities supporting refugees, wanting to do what they can in any way that they can, whether it's fundraising or it's work. So, you know, these are really great changes.
And thank you so much, Rosie, as an Australian woman, as an Australian, for everything you did and taking your story and just changing things. Thank you so much. Manasi, I'm going to come over to you in India now. I'll just make sure that your microphone is off mute, please. So I wanted to ask you, Manasi, you've done quite extraordinary work in changing public attitudes in India through your organization, which is OYSS Women. Can you please tell us about the actions that you took to bring together so many people for a cause to change attitudes in India?
Yeah, sure.
Thank you.
Hello, hi everybody. Sure, firstly, thank you so much for having me today. And I am truly honored to share the platform with a great panel. To start off with, I was born to a family where girls have never stepped out of the so-called safe boundaries of their homes. It was a place where we are taught to do certain things because our culture said so. I understood early on. It was not culture. It was just few individuals, and specifically men who forced upon us what they believed is the right way to be and to do things. I saw a leader in my mother. She never went for formal education. She could hardly read or write, but she wanted me, her daughter, to learn everything that was world had to offer. And soon I had my own dreams, my aspirations. No form of cultural constraint could stop me now. It was critical then. I understood to not just do it within a group of people I was comfortable with, but to inspire and include the mass. It is only when we are able to impact the common women and men on the street that change can take place. I have followed 3 strategies here. Firstly, through a bottom-up method, I have constantly engaged with the people and evaluate their needs. That is why OISS, women, was so critical here. Secondly, I have always believed in involving the other genders in the movement. Anything to do with women is not just a women problem. It is to do with the entire population. We all should actively take part in these movements and take actions. And that is when we can inspire any change in people's mind. And thirdly, I have tried to institutionalize these efforts through bringing different social actors into the movement and effort. At times, the government, other civil society, organization, and community leaders. These are the drivers of change, and it is only when you involve these different spoken others that any change can be sustainable.
Manasi, thank you so much for that intervention. That is, yeah, I really appreciate, especially the bottom-up approach. I just think there's no other way. I really share that with you.
Thank you.
At this point, I want to go now into services, because we've got what I see as innovators. I don't know if innovators is the right word to be using when we're talking about family violence, but Nathanial over in New York, Nathanial, who I owe a very big coffee to for getting up at 4 o'clock in the morning to join us today. Nathanial, thank you so much for being here with us. The Urban Resource Institute is, I mean, we connected because I wanted to learn from your organization. It was a bit of the inspiration for this event. You're doing such innovative work, such holistic work. You're going through prevention, through to support services, and you've got some incredibly innovative approaches even to support services. I think notably of your PALS program, which takes into account the role of pets as a barrier to leave. Of course, I had never thought of it as a barrier to leave, but it's also a part of the healing as a weapon as well in domestic abuse. You've created this incredible program, you and your team. Can I ask you, how did you get support to deliver such a comprehensive, innovative program that also is so research-based and really takes into account real practical issues? How did you get the support?
So Sarah, good morning, and I definitely want to thank you and your team for putting together this talk, because we know through forums like this, we really do and connected doing a lot of great work. So good morning again to all my colleagues. And Rosie, thank you. I want to say, first of all, sorry for your loss, and know that I was inspired. I am inspired by your story. I think that it's been my experience hearing the voice of survivors really impacts individuals from the heart and then shapes the mind in action. So thanks for continuing your advocacy, and know that I am inspired by it. So Sarah, let me sort of back into this question about Urban Resource Institute and some of its innovative services, and how do we sort of how do we get this support? First of all, I have the pleasure of working this year. We'll have about 800 women and men really working around our vision of a world free of domestic violence, homelessness, trauma, and poverty. And we really believe through our work, individuals and communities will be safe, stable, and thriving. So it's a tall order to be able to achieve that. And this work of ours was really made possible by so many women and survivors, and men too, in terms of the movement. And I want to say, in terms of the theme around changing minds and hearts, our president-elect Biden, I'm not going to get political, but just a sense of, really was, when he was a senator, was so instrumental in working on a major piece of legislation that also allowed for significant funding, the Violence Against Women's Act in 1994. And that act really allowed for the provision of laws and resources, billions of dollars, about over $1 billion, to impact police agencies, police departments, and courts. It allowed for shelters and other services to serve victims of domestic violence. So Sarah, Rosie, a lot of that work too came from a lot of testimony. You know, we can talk a lot about the data that sometimes seems so overwhelming, but so distant. And then when someone like Rosie shares their story, as they did in a lot of those hearings, it gave life to the experiences. So many women talked about the psychological abuse, the verbal abuse, as well as the physical abuse, and to the horrors of many. They talked about the economic abuse, the reality that their finances were being controlled, or they weren't able to work, or their credit was being destroyed as a way to keep them in a relationship where someone had power and control over them, using a lot of these tactics. And so I just want to acknowledge that it was so powerful, and that legislation allowed for an organization like Urban Resource Institute to be born. Now, even though we have hundreds of staff members, we don't do this work alone. It's sort of this community response to services, working to shape and influence society, and then of course, work to increase safety for victims of domestic violence. And so we're constantly learning from survivors and in literature and through forums like this. And some of our innovative programming really came to just that, understanding that a lot of our work is really understanding some of those barriers that victims of domestic violence have, and significant obstacles, and then doing something about that, whether it's from a community response, working externally or internally. And when we start to think about our work and understanding, you know, survivors are battling a variety of risk factors. For some, it may be, if I leave an abusive relationship, I may be shamed. If I leave an abusive relationship, I may not have sufficient funds to take care of myself, or if I have children. If I leave an abusive relationship during COVID, I may leave, and if I'm seeking safety through shelter, am I going to be more exposed to COVID-19? So a lot of risk factors. And learning from those risk factors, we shaped our services. And some of the innovative services, we started with prevention. We touch over 30,000 to 40,000 young people, ages 12 to 18 in schools. And we want to start early to talk about healthy relationships before abuse starts, to really start to talk about healthy relationships. And we train the peers, young people, to really create a culture and an environment to be able to talk openly about domestic violence, intimate partner violence, and create a community where they won't tolerate it. And I've been to so many of those schools and so impressed by young people really creating a culture where they're not going to take it anymore in terms of domestic violence. I've been around for a couple of decades, and sometimes one could become jaded. But hearing those young people really talk about the promise of tomorrow and what they want to stand for, truly inspiring. So that's one of our innovative programs. Our shelters are healing centers where someone has made a decision to leave and seeking safety, really very comprehensive. And it's, again, very trauma informed too, recognizing that individuals and children and women, children and men have been impacted by violence. Trauma is at the center of this, and we want to create a very healing environment from the time they call, come into the shelter, and then the services that are trauma informed from a client-centered perspective. That survivor has to be at the center of their activities. And shelter services are just that, from the support from other survivors to knowledgeable staff members providing individual counseling and group counseling, our opportunity to really work with individuals and their children. So we have child therapists in our domestic violence shelters, really all there to help individuals feel safe and heal. We have legal services. A lot of survivors, of course, are really impacted by, they need increased knowledge about opportunities from a legal perspective, working on divorce, immigration. And so we have attorneys assigned to our shelters to support survivors in terms of comprehensive services. I want to talk also about this idea around economic empowerment. So many survivors come to us and have made a decision to leave an abusive relationship. So what happens at that point? How do, I mean, we're in New York, and New York is probably one of the most expensive cities in the world. And so how does one make a decision to leave, and looking at those risk factors, not move into poverty? How do they then take care of themselves? And so we are very much focused on that. And we have an economic empowerment center that really works with survivors around increasing awareness of opportunities, repairing credit, looking at jobs and jobs of the future so they can maintain a safety in terms of being independent. One of the interesting programs, before I get to PALS very quickly, Sarah, is our turn to working with abusive partners. If we're working to end something, we really have to work with abusive partners, because while accountability is at the center of our work with abusive partners, those who do harm, and it was controversial when we started to work on this because it was the literature. A lot of people said nothing worked. And when we listened to some of these survivors, some survivors said, hey, I'm not going to leave my relationship. I just want the abuse to stop. And so working very closely in the sector with researchers, survivors, we created an accountability abusive partner program that really speaks to accountability at the center of it, but also really engaging that individual around change using a cognitive behavioral approach. So accountability at the center of it, and really engaging them about understanding that you've hurt somebody, but how do you stop doing that? Because we know abusive partners, when they go to jail or they're on probation, they're going to move on to another relationship. So our goal is to break those cycles. So abusive partner intervention programs is really, really on cutting edge, and it's very, very engaged with survivors too, who inform part of the work there. And so I don't want to hog this. I just want to talk about PALS. Sarah said, talk about this People and Animals Living Safely program. It was at a conference, international conference, where I heard one of my colleagues, Ali Phillip, talk about this idea of people and pets. Now, we deal with a lot in our field, and I couldn't imagine how pets played a role in domestic violence. But as she presented, attorney, author, in this very eloquent way, she really put it together. And we learned that over 48% of victims of domestic violence would not leave an abusive relationship because they were afraid of what would happen to their pet. And over 71% said their pet was sometimes threatened, harmed, and in cases killed. And we understood from natural disasters that people weren't going to leave their pets. So some of our national organizations had to really change their practices to incorporate pets. And again, we don't want to judge these barriers and risk factors. We want to understand that this is real for a survivor. So many is not going to leave. We want to have a response. So URI, in New York, we didn't have one domestic violence shelter that would allow people, survivors, to bring their pets in. And we work with the literature, we work with survivors telling their story, and we approach government agencies to change our regulations. They wanted to pilot because they were afraid of adverse effects. And we created a pilot. We did created a white paper to show the efficacy of the model. We partnered with the animal welfare community to bring some funding in, right? Because it impacted both communities. And by the way, while the domestic violence community, passionate advocates, I must admit the animal welfare community, those advocates are very powerful. So bringing those constituents together really created a powerful movement, bringing resources and passion. And we actually created and worked together to get a law passed, the Pets and Women's Safety Act, that also allowed for orders of pets to be put on orders of protection, and created funding to support people reducing barriers, victims of domestic violence, reducing barriers so they can bring their pets into shelter. And we have services for both pets and people, as well as outdoor playgrounds and pet parks, to really foster this sort of this healing environment on this sort of parallel process for both people and pets. Really exciting. Some of our new staff members say, I've joined URI particularly because of the innovation and the ability to work with pets and people around domestic violence. So thank you for your attention, Sarah. I want to give it back because you have such interesting panelists here. I want to hear what they have to say also.
Nathaniel, thank you so much. It's true. I think I hope that's been interesting for the professionals listening into this PALS program. Check out the URI Urban Resource Institute website. This is phenomenal. When I heard about it, I just think it's brilliant. Coming back to France, Ghada, you and I are both operating in France. You have done something extraordinary, what I find extraordinary. In France, we know one of the main problems is that a victim has to run around here and here in this association to try and understand all the various moving parts from a legal perspective. Then there's medical appointments. There's just so much. You have taken all of that and you've created a one-stop shop, if you will, for lack of a better term, where a victim can come, La Maison des Femmes. I believe you've got one in Paris, and I think you're opening one in Marseille, but you'll let me know about that. Where a victim can come and get legal advice. She can even do her police complaint. She can get trauma and support counselling, physical well-being checkups. You've really grouped everything together. You've obviously responded to a big problem in France with this holistic focus, and also putting, with your medical background, Dr. Hatem, you've put health at the focus to support victims. So I have to ask, I operate in France. How did you get such an innovative project off the ground? Who did you need to get support from, and how did you build it up? Was it local politicians? Was it government? Was it the community? Can you talk us through how you went about bringing this amazing service into being? And also, would you like to come and work for Women France as a consultant? Please.
So, hi everybody. Thank you, Sarah, for inviting me to this webinar. And thank you for presenting so perfectly well the Maison des Femmes. This project is just because I'm a medical doctor, so I was interested in my patients, and I very quickly understood when I was a young doctor how important was violence and how it could hurt their psychology and give them a very poor health. So my project is completely patient-centered perspective. We had some research in France that showed us what you perfectly explained, that the problem for victims is to do everything. I mean, their health, their kids, their home, their job, find a psychologist, find a lawyer, go to the police. So it's such a huge job that, first of all, they say, no, it's too much for me, so I won't move. And I just want to talk about pets. It's the first time I hear that victims don't want to leave their home because of the pets. I never had such an experience with my patients or in a French discussion about violence, so I was very interested with that. it wasn't easy, you know that, Sarah, in France, to just say, I have a very big idea and I want you to help me. So I felt very lonely at the beginning, and it was just step by step. I had to convince not politicians at the beginning. Today, we are maybe 8 years after the beginning of my project. They are convinced, and they try to put an amount of money for every doctor who want to create a maison des femmes in his hospital, because the model is centered on health, and we need to be close to a hospital because it's very useful for women. So I had to convince the community. And my first friends in this project were the private foundations, like the Caring Foundations, the L'Oréal, Elle, and many others, because some of them are directly concerned by victims, and they found that this one-stop shop was effectively innovative, and they wanted to help me to start this operation. It took me 3 years to collect the money, and then to find an architect and to create the building. But after we opened in July, and next year we were too small. We had to build an extension, which is just now being achieved, because we were immediately many women came to seek for help, and all the other hospitals, the social workers, the emergency doctors, everybody wanted to send us patients. And we had also we had to deal with migrants, because in France, and especially in Saint-Denis, where I work, we have a lot of migrants, and they have a lot of problems with their health, with their they seek for asylum. It's very difficult for them. So we have a lot of work to do also with these women, because women who seek for asylum in France, I think it's the same in every country, but their life is full with violence. Let's talk about Africa, for instance. When you are a young girl in Africa, you just are circumcised when you are born. Then you can be raped by anyone in your family, because, as you know, home is the most dangerous place for children and women. Then your parents give you in marriage when you're 12 or 13. And of course, your husband is very old. You don't want to have sex with him, so you get raped. And as you don't want to be raped, so you face violence. And it never stops. And when they ask their parents to let them come back home, the answer is always, these are our traditions. And what I'm fighting really is all these harmful traditions, because everywhere in India, in Pakistan, in Africa, and also in Australia, in France, all women face these really awful traditions. And I just don't want to forget men. Men face also these ugly traditions, because they are expected to have a very strong manhood. Is it the wrong? Thank you, Sarah.
I think we like the term toxic masculinity.
Yes, it's the same in France. We say also toxic masculinity. So sometimes they do not want to be so toxic, but this is the way they were educated. And if we talk about forced marriage, sometimes the boys say, I didn't want to marry her. I had another lover, but these are our traditions. So I would really like to make an advocacy against all these harmful traditions, because it's enough.
Well, thank you so much for sharing that with us, and I certainly look forward to working with you in France, and I certainly look forward to seeing you for a coffee as soon as we can. Right.
I would love to work with you, Sarah.
No, it's but really what you've done with Les Maisons des Femmes, it's extraordinary, and as you said, in France, we've got our French colleagues joining us, trying to do something ambitious and do something you know, that's new, can have its additional cultural challenges in France. Yeah. I'm not French bashing.
No, it has nothing to do with French bashing, but it is the way it works. People say, show me that what you're doing is really, really important, and then I'll think about helping you, maybe.
Yeah. Yeah. Well, anyway, thank you so much. Look, we've got, I mean, I wish we could speak for another 3 hours, because I think that we could. So we're going to be doing this again. I just really want to quickly, I've got some questions coming through from our participants. So thank you all for sending those through. I've got so many, so I'm not going to be able to get to them. I'm really sorry about that. Maybe tweet them. I don't know. We can try and connect in some way. We can try and send these questions on to the panelists afterwards. We wanted to touch on police and legal reform. So I'm actually going to look at some of the questions regarding police and legal reform, because I think, Rosie, you've got some interesting insights into this. Okay, so we're looking, yeah, this is interesting. So I've got a question here from Lucy Lennon, a human rights lawyer in Italy. We're hearing a lot about changing laws, making them better, more powerful. But if the laws aren't applied, can I high five you, Lucy? Thank you. If the laws are not applied, nothing is achieved. Is shaping cultural attitudes more important than the laws themselves? I find that's a fantastic question. Thank you, Lucy Lennon in Italy. This is a really fantastic question. I haven't got who it's directed to. I might go to Rosie. Rosie, what are your thoughts?
Yeah, absolutely. I think that very topically at the moment, there is a big push to introduce coercive control, criminalising coercive control. Many people would say that's a really obvious and a very good idea, and others would say that is fraught and has a lot of unintended consequences for women with disability, for Aboriginal women, for migrant women. What I will say is the police are very reflective of our societal attitudes. They hold racism, sexism, and they ultimately misuse their power on many levels. Now, I would like to think that Australian police are quite good in comparison, but quite frankly, there is an awful lot of work to be done. What I will say is, when my son was murdered 7 years ago, we had a police commissioner here in Victoria that was absolutely passionate about gender equality and family violence. That leadership from the top, from our police commissioner, made a huge difference. When he retired, that type of it's wavered somewhat, but I will say that it is the cultural change that is a result of our Royal Commission to Family Violence is really an ongoing thing, and ultimately that, years ago, police didn't respond to family violence incidences. They didn't acknowledge it was an interruption to their day. It was, just another domestic. Now we have family violence units. We have a much more improved response to family violence. It doesn't mean to say it's perfect. It can be very dependent on the police station itself and the leadership within that police area. But ultimately, you are more likely to have a more favourable response than you would have been 5 or 10 years ago. We still victim blame. We still look at, you know, it's still, again, very dependent on you know, over-policing. Aboriginal women, again, 35 times more likely to be hospitalised. It's, you know, so what I will say is law, many of our laws are okay, but putting them into practice, the decisions that are made, the bias and is constantly frustrating and really questionable, and particularly through our family law court system, that is an appalling reflection of really where women are grossly disadvantaged, and children continue to be put at risk and forced to meet with and continue relationships with violent parents. So what I will say is, yeah, the law is very important, but with the cult, you know, it really depends still on a huge degree of cultural reform, which is what I would hope that we'll continue to work within here in Victoria. At least we have a political, I believe, a political emphasis that pushes and supports this issue top of mind.
Yeah, look, I mean, it's so true, isn't it? These laws, we've got the laws, we've got the measures, it's the practical application. Rada, you know, we struggle with that in France. We've got all the laws, we've got all the measures, there's nothing wrong with the laws, it's the applying. Nathaniel, have you done any work with the police in the state of New York to try and get them to, and I'm focusing on the police because I've got a few questions coming through regarding the police and how they work. Have you done any work to help them better receive domestic violence victims and survivors? And I'd just say at this point, Nathaniel, if you could keep it really short, because we've only got 6 minutes left. Sorry.
Yes, we have. A lot of the work is also understanding the limitations of the police department. And so one example would be that in some of our areas, in some of our work, we've attached advocates to police precincts. So when police respond to a domestic violence call, they have a trained advocate in the car with them. And so that helps the response to victims. We still do a lot of training. We go to their conferences. I sit on the fatality review committees where law enforcement is represented, and we go through, unfortunately, fatalities and what happened from a system perspective and how we improve. But having advocates also participating when they're responding to incidents, very, very helpful.
I think that's a wonderful idea, having advocates in the police. It's something that we should definitely be looking at here in France. There's quite a lot of discussion here about victims being turned away, come back tomorrow. You know, it takes such an enormous courage for a victim to go and do this in the first place, to go and see the police.
Yeah. Sarah, I just want to say, though, out of the fatalities, over 70% of individuals, particularly around fatalities, did not have any criminal justice involvement, right, for a variety of reasons. So I just want to say, I know we're going to focus on criminal justice and NYPD, or NYPD Police Department, but a lot of victims don't seek criminal justice as a means of intervention.
Rada, how do you think we can change the situation in France? Are you fixing it, or should I be? How can we work together? How can we change this in France?
In France, as it was said, we have laws, but they are not really active. We started to work with police, and around the Maison des Femmes, we participate in the policeman education to explain to them how it works, how violence have to be addressed, and why the victims seem so hesitating. And it's not because they are not victims, it's because they have, how do we say, a very strong grip by the abusers. And it's not very easy to understand if you didn't get really in it. So we try to explain to them how to talk to a victim, how to be respectful. And we hope that because we're not the only ones who act in this education for lawyers and policemen, things are changing, but very, very slowly. It's very, very important to explain to people who are supposed to be in touch with victims to really understand how it works in their mind. It's not intuitive.
Yeah, well, look, I think that's something that around the world, let's keep this conversation going. We're all struggling with that. Organizations in domestic violence and domestic abuse, where, one thing my team hears me say all the time is, if practically the laws aren't applied, it's like saying domestic abuse is cool and normal and completely legal. It has to be pragmatically applied. It has to actually work. Manasi Masani, who is has done an extraordinary amount of work in actually developing a charter and getting various politicians on board. Manasi, I won't bring you in for a question now because we are coming to the end of our time. But I would like to sincerely thank these incredible panelists that have joined Women for Women France this morning for a conversation. It's been a great conversation, and as I said, I wish we could speak for hours, and surely we will. I've got all your phone numbers now, so I'll be calling all of you, but we will do this again. This is the first in a series. We are gonna touch on a bunch of different topics. We wanted to open up with advocating for change because, well, it's the big one, and I think it's a really great start. So thank you so much, Masani in India, and Nathanial in New York in the USA, Rosie in Australia, and Ghada down the road in Paris. So thank you so much for joining us, and thank you for sharing. To all of the experts and professionals around the world who joined us today, thank you so much for your time. I know after 2020 everyone has webinar fatigue, so I hope that you found this to be a great conversation, and please everyone do stay safe. Please keep in touch. Thank you.